Today, after 7 months of active negotiations with the federal government, I'm pleased to inform you that effective February 1, the Healthy Indiana Plan will be available to more Hoosiers than ever before. The state of Indiana has reached an agreement with the federal government on our Medicaid waiver. The Healthy Indiana Plan 2.0 has been approved.
It's a game changer. It's a life-changing possibility to upgrade a little bit more every month to get the care that we need. I just never heard anything like that. I can't believe it's available.
Yeah, to be healthy, to have these people allowed to have insurance and go to a doctor and take care of small things when they're small. As long as you help them stay healthy and catch things when they're just beginning, just catch a little problem, it can be fixed so easily instead of long drawn out recuperative situations.
These are not people that were laying back trying to take from the state. These are people that are trying to get a step ahead, and often it's health care that held them back.
And frankly, the way the governor set up HIP with a lot of preventive aspects to it really encourages people not just to have skin in the game by paying some money to be in, but also encourages them to look at a new way of dealing with their health care. Getting preventative care, early intervention, which has been so important both on the mental health side and the physical health side too.
Speaking for what I know about rural folks, there was such a need, more access to care, prevention and wellness opportunities. I think the whole industry and individuals themselves are really figuring out the best way to lower cost in healthcare. You hear about that all the time, is take more personal responsibility for your healthcare. And HIP 2.0 gives that most vulnerable population an opportunity now to do that.
When you do something that benefits you and makes you feel better, you do want to share it. You want other people to know that this is available and nobody has to go without being able to go to their doctor when they feel something's not right.
What we know about behavioral economics is that incentives do push people to make better choices. We do that in finance, we do that in health, we do that in education.
HIP 2.0 is hardly a tough sell. People see right away that it's an insurance program that was designed for them, and they're eager to enroll. They don't mind the skin in the game aspect of the program. We don't get complaints about that. People are able to pay those small amounts.
In some of the most rural areas that we serve, in some of the poorest urban areas that we serve, I've not heard the barrier being, the power account contribution.
I'm not surprised at all by the high percentage that are paying their way and staying on the higher level plan. The amounts are relatively minor, but they're significant in terms of the person having the pride and the dignity to go in and make that payment every month.
I had not had new glasses in 12 years. I do now because of the little premium that I'm allowed to pay. To be able to see is so important. Without it, you can't read, you can't write, you can't do art, you can't even wash your dishes right.
Well, I think what's so excited by the efforts of the state and how that has played out in the lives of my neighbors is the idea that they have choice. They can choose what direction they want to take in their health care. It's empowering to those in poverty to be able to say, I can choose what's best for me and for my family, for my kids, and for my spouse.
One of the great things about HIP 2.0 is that if we can actually say and demonstrate that minorities benefited from this, I mean, that's a very, very good thing for the state and the nation.
Right.
Because in minority health, you need models to illustrate what can be done.
We know for a fact that the earlier you are able to catch somebody with a mental health or substance abuse condition, the earlier they receive treatment. That's the key, early intervention and prevention. And the fact that HIP 2.0 focuses on that is exactly what we need in the behavioral health realm.
It's excellent. But the thing is, you feel good. You feel good again. And I think everybody wants to do that.
If anybody hears this that can get something out of it, do it, because the benefits are incredible. The program's amazing. Usually when you tell somebody about something that's really good and it works, it's amazing how many friends you can make. And it's true.